Thank you for choosing Lakeland for your surgery. Our physicians, nurses, and staff are dedicated to medical excellence and compassionate care for you and your family. At Lakeland, our mission is to provide high-quality, high-value, compassionate healthcare services. Lakeland has been ranked among the top 1% of hospitals in the nation for excellence in clinical outcomes, patient care, and patient safety.
Here at Lakeland, we want to make sure your surgery experience is as comfortable as possible. If you have any questions about your specific surgery, be sure to talk with your doctor. We hope this video will give you a better perspective on what to expect on the day of your surgery. Your doctor may want you to have some tests before surgery. In fact, most of our patients will have tests, such as blood tests or x-rays, before surgery. These are called pre-admission tests. These tests are important because they provide your healthcare team with valuable information about your current health status. They should be performed approximately 7 to 10 days before your surgery. This time frame may vary depending on what surgery you are having, your medical history, or what has been decided by your doctor for you. You will have to fast, which means you cannot drink or eat anything after midnight the night before surgery. This includes water, coffee, chewing gum, and even breakfast. Fasting is a safety precaution that must be followed by every patient before surgery. If you take medicines on a regular basis, don't worry. Your doctor will let you know if you can take your medications before surgery. If you have any questions, please call your doctor's office. You will be asked to arrive at the hospital 1 to 2 hours prior to your procedure, depending on your doctor. During this time, your care team will be completing necessary steps in the pre-procedure process. This will help us confirm your medications and how often you take them. Just put all your medications in a resealable bag, like a sandwich bag, and bring the bag with you on your surgery day. If you wear eyeglasses, contact lenses, hearing aids, or dentures, you should bring them along with your storage case and any other supplies you need. As a precaution, you should bring along any important legal forms, like a living will, healthcare surrogate, durable power of attorney, and/or guardianship documents. If you have an advance directive, please bring it with you. Make certain to bring your insurance card and copay when you register in admitting. Also, bring any paperwork your doctor has given you, like permits and lab orders. If you received a green armband when your blood was drawn from the laboratory, please make sure to bring this with you as well. It's a good idea to make a file about your surgery. It will help you have all your important paperwork in one place. Have it ready to go the evening before your surgery so you don't forget to bring it with you. You should leave items you will not need, like jewelry and credit cards, at home. If you need to bring your wallet, purse, or car keys, make sure you give them to a friend or family member for safekeeping while you are at the hospital. If you are like most people, you always want to look your best. But remember, you're having surgery. Please make certain to not wear any perfume, makeup, deodorant, lotion, or baby powder to the hospital. You can brush your teeth, but remember not to swallow any water during the process. Be sure to wear comfortable shoes and loose, casual clothing. Now that you have arrived at one of Lakeland's surgery centers with everything you need, let's cover what you can expect. Your first stop will be in our visiting center, where we will confirm your personal information. If your surgery is being performed at Lakeland Community Hospital, Niles, please remember that you will need to take the elevator up to S2 to be admitted. Once you are admitted, you will be directed to the waiting room by a caregiver. Please remember that throughout your stay, you will be asked the same information several times. This is done to double-check your information and is part of our surgery process, which has been designed to promote patient safety. After signing in, please relax in Lakeland's family area. You will be notified when your room is ready. From your identification bands to your medical history to a pre-surgery meeting with your anesthesiologist and surgeon, we will ask you many questions and keep you informed as we are preparing you for surgery. No one likes to wait, but delays are possible. Your surgery start time often depends on the situation surrounding the patient treated before you. You will be updated at least every 30 minutes if there is a delay, and we certainly appreciate your patience. Before your procedure, a registered nurse will greet you and will take a moment to check your ID bands, review your forms, and ask some important medical questions. You will be able to ask any questions or express concerns during this time. If required, an IV will be started by a registered nurse prior to your surgery. Your anesthesia provider will come and speak with you to review all your medical information. The anesthesiologist will discuss with you and your family the safest plan of anesthesia for your surgery. Next, a registered nurse from your surgical care team will transfer you to your operating room. We will periodically keep your family up to date on your progress while you are in surgery. After surgery, you will be monitored closely in a special recovery area. As you rest in this recovery area, you will be monitored by Lakeland's experienced staff. Our staff will help manage your pain level, answer your questions, and keep your family informed about your recovery. If you are having an outpatient procedure, once you are ready to leave the recovery room, you will join your family and friends. When you are released from the hospital, a family member or friend can pull the car right to the door to pick you up. If your surgery is at Lakeland Regional Medical Center St. Joseph or the Center for Outpatient Services, you will be picked up at the surgery entrance. If your surgery is at Lakeland Community Hospital Niles, you will be picked up at the river entrance. Please remember, if you are going home, you must have someone who will stay with you for 24 hours, so they are available to you if you have immediate needs at home. Be sure to follow your doctor's instructions about physical activity and exercise. If you have any questions about your medications, ask your doctor or any member of the surgery care team. We want you to feel ready to leave with all the information you need to care for yourself at home. If you will be staying overnight at one of Lakeland's hospitals, you will be taken to your room as soon as you are ready to leave the recovery area. We will make certain your family knows to which room you will be going. Your length of stay will depend on what kind of surgery you had and how you are doing after surgery. You may stay in the hospital one night or longer. Regardless of how long you stay, we are committed to providing the best patient care and will do everything we can to make you as comfortable as possible while you are with us. If you have any other questions, ask your doctor or any member of our surgery care team. Thank you for choosing Lakeland HealthCare. We look forward to providing you with excellent, compassionate care.